with, he has recommend.
Girl, I got two. Then do more
Diagnosis or jaundice of the,
No, I don't.
There's
No. I don't have a word.
Save it down.
I'm assessing her hair inspection. Her hair shows a thick head of hair. There doesn't appear to be any evidence of any mice, parasites. There's a little damage, dandruff. That's her. That's okay. Her hair is soft to touch. She's normal cephalic. See, I just go down, I'm doing the ears, okay. Auricle tragus, no tenderness. At this point, I start doing my lymph nodes while I'm here. When I do my anterior posterior, I would check, go down the muscle. Supervent, shrug the shoulders. And, right, and I can continue with my lymph nodes palpating under into my tail of Spence.
Yeah. That's a little tender. So I think it's like tender.
Oh, okay.
No.
Okay. Now, here you can also assess the pulse, if you like, at this point. The pulse is full bounding, symmetrical. I can also look at her skin and upper extremities, her skin trigger. So someone should be checking this off because this is what we're going to be doing, checking off, okay? Now, so I did the 5 points with the general, correct?
Mm-hmm.
So now, I did my lymph node change, okay? What I didn't do,
Consular.
right, okay? Here, occipital. I did.
Pretty early go. Anterior, posterior, the stern.
But that's when I went along here, okay? All right, could you take your glasses off? I would just describe her head as normal cephalic, it's round. I don't feel any nodules, okay? Atraumatic, because it seems to be symmetrical, right? When I describe her pupils, they're brisk, and it appears to be the pupil gauge at 3 millimeters, all right? You want to do consensual? At this eye. You have to turn the light off for that. Okay, and you really can't see the consensual. I can turn off. I can't really appreciate the consensual reflex, but this is the process. And what should happen? I should see in this eye constriction of the opposite eye. Now, because she has brown eyes, if she had blue eyes, like possibly you would see it better on Aaron, because there's a color contrast between the iris and the pupil. Okay? At this point, you're looking at the sclera, there is no jaundice, okay, which we've already discussed. Right? You can do the, what I call it, get a little piece of cotton. All right. And you can be like, Okay? And what am I looking for with that?
I don't know.
That part, the whisk test is part of your...
No, it's not on there.
I've never heard that. And I was like, whoa.
Okay.
Just to see what they do in the real world. When I get there, I'll be doing that stuff.
Okay. Sinuses. Now, for me, I know Professor Barrick has taught you guys, when I do my assessment for the sinuses, I do my frontal lobe here, and I apply pressure. If there was any discomfort here, that's an indication that she has possible infection. All right? Open your mouth, please. Sorry. Okay. A buccal cavity is moist, pink. Lift your tongue, raise your tongue. What cranial nerve am I looking for? Okay, and that's cranial nerve.
12 or 11.
Okay. Stick your tongue out and look right to left. Okay. Also, when you look in the mouth, you're going to talk about open your mouth, the teeth. The the uvula is midline. She has no teeth missing. Okay. Her soft palate and hard palate are moist. Her tongue is midline. There aren't any lesions in her mouth. Okay. For me, when I do the thyroid, I go on the back. I palpate the thyroid. Her thyroid is midline. Have her tilt her head to the side. The side that is tilted, I would displace her thyroid and have her to swallow. If you feel the thyroid go up and down, there's no nodule. There's no mass. On the other side, and swallow. Okay. If you talk about, also with the neck, you can look for JVD, but they would have to be at least 30, 45, at a 35 or 45 degree angle. All right? So listen to the carotid artery. I would auscultate first. Okay? I use the diaphragm, but I guess it's suggested you guys use the bell. But I use the diaphragm whenever I can. Right? Left, listen. Would you hear anything when you auscultate?
If there's a birth, if there's a spirit.
Okay, if you hear a swishing sound, that would indicate
A bearing.
a blockage. Okay. Now, if you auscultate, you don't hear anything, then you can palpate. Just lightly palpate, because with the carotid artery, you can cause the patient to pass out if they have hypersensitivity. And it's possible. Okay. Also, when you look in the mouth, you want to look for their tonsils to see if they're
Swollen or inflamed.
correct. Correct. How am I doing so far? We're okay? I'm checking. No, I couldn't check in midline. I did.
Yeah. Oh, you didn't do the nose at all.
Oh, the EMI.
I like that. And you didn't do the nose.
Ding, 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 right? Okay. With the EMI, we're looking for muscle coordination. Okay? That's 3, 4, and 6. 3, 4, and 6. Cranial nerves. All right? Look at the pen. And you see, I don't rush through it. Look at the pen. What is that? Conversion. Okay. With the nerves, you look in the nerves. She has turbinates. They're red in the left and in the right. No mucus, no mites, no crustaceans, no drainage. Okay, the nasal chest. Could you put your finger over low? Okay. There is anything missing? Okay. I did the ears. Oh, TMJ, well, the TMJ, open and close your mouth. Open and close. Now, if you don't feel a click, that's normal, okay? If you feel a click, that could mean there's some inflammation at that joint. What I didn't do was the ears, you look at the ear canal. Okay, she has some cerumen in her ear. I don't know why. I clean them every day. Okay, and the left ear, there's some crustacean. Okay, and the right, there isn't. Okay. Right, that's what I'm saying. This will always. Okay. Okay. I know, my friend. Hearing. Okay. How am I doing?
Should we do that? So people are doing that too?
Oh, we didn't do this.
We just, oh. Turn your head. Now this is assessing muscle strength.
Yeah.
Okay. Now turn your head, your chin to your shoulder. Okay. Chin to neck. Yeah. It's the shoulder. Oh, you should be doing it on me.
That's it. Okay.
Now we're doing it on me.
Resistance.
Resistance?
Well, we did this.
Oh, this is resistance.
Yeah, and then the shoulder.
Shrug your shoulder.
Okay.
Okay.
Upper extremity, that's done. Okay, now we look at the arms. We've already discussed her skin, the temperature. Okay, we assess the radial pulse. We need to assess the brachial pulse and assess the pulses.
Bilateral.
Brachial. Radial, ulnar, and brachial.
Right. Okay. It's correct. Her pulses are bilateral. They're full. Okay. We assessed the radial previously. Ulnar. And you need to tell your patient to take off their watch. So the ulnar on the other side of the right here. On the ulnar. And then you may not be able to assess the ulnar. I can't.
Oh my goodness. Girl, please.
Okay. Did I miss anything? That's it? Okay. Now.
Abduction.
Oh, okay, now, with the range of motion, you can wait until the end, or you can do it as we're going along. Okay, so, let's do flexion, shoulder flexion, extension, abduction, adduction, okay. Now, while they have their arms out with the abduction, you can have them to do rotation. Inner, outer rotation, okay. All right. You put your adduct. Okay.
Yeah.
Well, then you guys know. Okay. And then also, let's do the flexion since we're dealing with this.
Oh, okay. That's what we did.
Okay. Squeeze my fingers.
Okay.
Okay. Make sure that if anyone squeezes your fingers, you don't have any rings on them. You can do cap refill. You need to watch the time.
3 seconds.
Yes, refill in this lesson. All right. You look at the nail beds. They're pink. There's no evidence of cyanosis, no clubbing, which is important. Which indicates that she's oxygenated well. Now cardiac? Oh, wrist. Inner rotation? Outer? Okay, spread the finger. Low.
Good job.
40.
So you want me to take my shirt off?
Yeah, but they're recording, that's okay.
I can.
That's it, right? Okay. Now, 1, 2, second intercostal space, right of the sternal border, you have your aortic, your cardiac assess aortic, pulmonic, which is second intercostal space, left of the sternal border. Fourth intercostal space, left of the sternal border, is your tricuspid. Mid-clavicular fifth intercostal space will be your mitral, also your tricuspid, which is also your point of maximum impact.
That's your apical? No?
Apical, that's where the
Apical, tricuspid.
Okay.
And I think
Aortic,
we have to do it with
tricuspid,
the bell and the diaphragm.
aortic, tricuspid, aortic, pulmonic, tricuspid,
Tricuspid,
mitral.
mitral.
Okay. Now, it may also ask you to assess the aorta.
It doesn't.
Now, it does not? You don't need to. Okay. Why would you assess the aorta? So you would do it with the bell and the diaphragm according to your. I have a double check. That's it? That cardiac? Okay. But, feet on the ground. Make sure that throughout the procedure that your patient's feet is flat on the ground.
Because you will get there and can't.
You're too short.
Yes.
I have my flops back there. Now, cardiac, we're done? I got the 5 out of 5? Okay.
3 out of 3 out of 3.
3 out of 3?
The first one is that you're supposed
5
to
out of 5, okay.
see if it's PMI. And then the fine.
All right, for auscultation. I auscultate in the back, listen to the lungs. So, I do the base first, right and left. Inhale and exhale is 1 respiratory cycle. Inhale, exhale.
So we're telling them to do their nose or their mouth.
I tell them to, I have my patients inhale and exhale through their mouth, okay? Well, I'm not listening, so.
No,
Okay.
you're gonna like the
Inhale, exhale 1 cycle. 1, inhale, exhale 2 cycles. Inhale, exhale 3 cycles. Inhale, exhale 4. Inhale, exhale 5. Inhale, exhale 6. Inhale, exhale 7. Inhale, exhale 8. And then you can come lateral. Inhale, exhale 9. Inhale, exhale 10. That's your 10 cycles. Okay? Anterior. Inhale, exhale 1. Inhale, exhale 2. Now, if you notice, I did like more of the H. That's the H formation. Inhale, exhale 1. Inhale, exhale 2. Inhale, exhale 3. Inhale, exhale 4. Inhale, exhale 5. Inhale, exhale 6. Inhale, exhale 7. And it may be difficult. Inhale, exhale 8. Inhale, exhale 9. Inhale, exhale 10. Okay. So if you just do the 10 points, you'll be fine. All right. Again, when you inspect the anterior chest, you guys will have a halter, so they'll be able to assess. There's no, the mammary glands are symmetrical. Okay, there doesn't seem to be any lesions on her skin, no scarring. All right. And the back, and then we would percuss. Okay. Now, in your handout, it has percussion, then palpate.
Yeah. Doesn't matter.
No, it doesn't matter. It doesn't matter. For the abdomen, it does.
It does.
But for the general, it doesn't. Okay? Okay? You're listening. If it's bone, it should be flat, right?
Yes.
Over lung tissue, we should have resonance. Okay, you can hear it. Now see, you see that, you hear it, okay? Oh, yeah, that's the procedure. in the back. Okay? 10. I do 10 points. You guys will be okay. Now, I will do light palpation, right? And I'm feeling for any nodules, if she complains of any tenderness.
Your face looks like your face. My hair is on, so that works.
Okay, I'm sorry.
No, it's okay.
8, 9, 10. 10 points. You're fine. 1. Okay? 10 points. You're fine.
So it's the same 10 points that you
10 points. There's 10 points.
Yeah.
You're done.
Okay.
And you're fine. Or Professor Long note. Okay? Okay. Now. And that's in the back. And this is called what? Tactile parameter. Okay. And 99?
99, 99, 99, 99.
Okay.
Did you say about 499?
Yeah. But my hands are big and, okay. Now, she can say, another thing, she can say what? Ah. Ah. And while you're back here, you can check the version. Okay. Take a deep breath. You see they part, and they come back together. Again. Come back together. Now, you can also inspect chest exposure. You can inspect the spine. Same attachment there, okay? Oh. Uh-oh. Yes. I've not shaved all my life. Yes, I am. So this is inspection of the spine, all right? Chest, that's all I can think of. Yeah, chest. Oh, okay. All right. Now, with the abdomen, you can get the mannequin. You have on your gloves, all right? So with the mannequin, right, because your patient, you need to be lying down, and your patient.
Yeah, you can verbalize and move it right along. Patient will be lying down. Patient will be lying down.
Tell me what.
In the supine position, I would start in the right lower quadrant. I would first. Can we just I'm just gonna verbalize. Move it on. Yeah, can I just verbalize?
You can just verbalize it, okay? So you would start.
Oh, flow.
Okay, you would inspect first, okay? The patient has ostomies.
Yes, he does.
An ileostomy.
Colonoscopy. Sorry.
Stomas.
Sorry, ma'am.
It's a flat belly. Let's assume that we don't have any stomas, okay? So it's a flat abdomen with no scars, or a flat abdomen with 2 stomas, one in the ileum, one in the where the sigmoid would be, okay? Region, there are no bags attached. The stomas are pink in coloration. At this time, there's no stool or drainage coming from it, okay? Now, then we would auscultate, okay? So with auscultation, right lower quadrant, we will listen, and we will listen up to as long as 5 minutes if we need to to assess if there is any vowel sounds, and we would document or verbalize the vowel sounds as being brisk or sluggish, okay?
Oh, you do have to take the yoga. It's there? It's there, but in the front of part.
Oh, okay. So I was right.
Yeah.
Is it a star next to it?
Yeah.
I asked, okay, so with the aorta, okay, if this is our, okay? All right. Now that we've auscultated, the vowel sounds are brisk, okay, or whatever, or sluggish, we would then, we would palpate that. Palpate. Wait a minute.
No, you palpate.
Palpate.
You palpate, then you.
So you do light palpation.
Is there any
Ask if
pain?
there is any tenderness or discomfort.
Do we do one per quadrant or like two per quadrant?
What do you mean?
Two palpate per quadrant.
Oh,
Or one.
I know for percussion, we
what do you
like
call a
three.
palpate? Oh,
For
well,
like
I do a
palpate,
circular motion,
Okay.
okay, to assess if I feel anything. And I guess my circle is 1, 2, 3. 1, 2, 3. Okay? Light, then deep. 1, 2, 3. And I would say do 3, because I never counted them, but I guess for you I will. 1, 2, 3. To make sure that you assess, okay, that you're able to palpate anything. And then you would percuss.
And we should hear timpani, sorry. Resonances in the lungs.
But see, I do more than 2 when I percuss, so
You do like
1, 2, 3, 4, 5. Usually I do.
No, I think what she meant was like, for example, the ascending column. If you do
oh, no one better not call me.
transfer.
I see on my video.
So this is my lower right. I'm doing lower right, upper right, upper
Oh,
right.
no,
Yeah,
4 quadrants, there's 1 per quadrant. I got you now. Okay, no. Just 1, the right lower quadrant, right upper quadrant.
Okay, so 1 per quadrant.
Yeah. I'm sorry, I didn't understand what you were saying. Okay. So we did our inspection, our auscultation, our palpitation, and our percussion in the abdomen. And that's all you have to do in the abdomen, and you need to deliver to percuss. Okay. Now with your liver stand, the liver's on what, the right side? Okay. Or like in your right upper quadrant, and just move your way.
And what should you hear?
When you get
Dullness
the
for any
liver
organ.
over an organ,
Right.
it should be dull.
Dull.
So that's where you would say that it starts.
That's the beginning, right,
Changes from timpani
to dull. That's the liver, okay? And you can measure it from like your right upper quadrant or where your umbilicus is up to how many centimeters you hear change. But they're not going to ask you that. They're just looking to see that you know the technique. Yeah. And just tell them that you would percuss up until you hear a change, and then that will be the border of your liver. That's it for the belly, right?
Also, this palpate for rebound tenderness.
Oh, you have to do it deep.
Okay, and that's for the appendix. So it's the right lower quadrant, and you would take the technique, use both hands. But you see, we don't do all of this when we don't.
Right.
Okay, you would
Unless
take
it's
both
like a
hands,
focus
you would
assessment.
press down, and then release quickly. And if the patient has an infection, peritonitis, they would scream bloody murder.
Oh.
Okay, for rebound pain.
Okay.
Okay, that's the procedure. Okay, what else now? Lower extremities, back to Valinique.
Back to that.
So we're almost done. And you see how long you got?
Hold on, it's going to redo it.